State lawmakers meet today to discuss House Bill 1741, which would allow doctors to prescribe off-label drugs to patients who are battling COVID-19. Thanks for joining us this evening. I'm Evan Forrester. And two of the main drugs in question in the bill are hydroxychloroquine and also ivermectin, both of which are not approved by the FDA at this point to treat COVID-19. Fox 43's Shaquille Amari is live at the state capitol this evening, where he heard arguments about the use of those drugs for COVID-19 patients.
Evan, the battle to use alternative treatments is surging as more families say they're left with little to no options to treat their dying loved ones. Now, this all came down to medical professionals who want to prescribe, but doctors who say these drugs aren't yet proven. As more Pennsylvanians become hospitalized with COVID-19, the fight to try different treatments not approved by the FDA is on.
We need to give everyone more resources, and let's put as much money and effort into treatment, preventative and outpatient treatments, as we are the vaccines.
Today, Republican Representative Dawn Kiefer and supporters spoke in front of the Health Committee pushing for House Bill 1741. The bill would allow doctors to prescribe off-label drugs like ivermectin and hydrochloroquine for patients battling COVID-19.
It's really important to me because we have limited treatments right now for inpatient and essentially no treatments for outpatient.
In a statement, the Democratic caucus said the bill would potentially tie the hands of medical professionals to prevent potentially lethal combinations of drugs. The FDA has cautioned patients not to use ivermectin and hydrochloroquine due to a number of health concerns, such as vomiting, nausea, and even death. With hospitals not prescribing alternative treatments, one doctor says it prevents freedom.
My purpose of being here today is to rebuild the physician-patient covenant and prevent physicians' hands from being tied.
While other health professionals say there's no evidence that the drugs work, adding that antibody treatments and vaccines are the only options to treat COVID-19.
There's no supplement or other over-the-counter treatment that would even come close to the effectiveness of the vaccine.
I think we can't put everybody into a one box in medicine. It's not one situation. It's not for every individual.
And Representative Kiefer says she plans to make amendments to the bill and hopes to move it out of committee by February. In Harrisburg, Shaquille Omari, Fox 43 News.